Good morning, good afternoon, good evening. Welcome to this HCC webinar entitled Changing Systems, Healthier Lives, the Caribbean's Journey to UN High-Level Meeting on NCDs and Mental Health. I am your moderator and host, Kenneth Connell. I'm also the president of the Healthy Caribbean Coalition, and it is my distinct honor, but grave responsibility to get you through this program in just about 90 minutes. And so I shall get moving with my opening remarks and welcome to all of you who joined us from near and far as the technology allows us to. Distinguished delegates, colleagues, and friends, it is both an honor and really a profound responsibility to address you today as president of the Healthy Caribbean Coalition at this very critical juncture as we look towards the fourth UN high-level meeting on non-communicable diseases, or NCDs. We gather here not just to discuss policy, but to confront one of the greatest threats to public health. Dare I say, to our Caribbean's public health, economic stability, and the sustainable development of the region and our extended world. NCDs, heart disease, stroke, diabetes, cancer, and chronic respiratory illnesses are the leading causes of death and disability globally. That is understood. And the Caribbean bears a disproportionate burden in this respect. We live, work, and play in a region where more than 70% of deaths are due to these diseases, often striking in the prime of life. It devastates families and it overburdens an already fragile health system. This is not just a public health crisis for those of you joining us this morning. It is a social and economic emergency that demands urgent and bold action. Over the years, we have seen progress, policy advancements, multi-sectoral collaborations, and increased awareness. And our Caribbean governments and institutions, including civil society organizations, should be congratulated for these achievements. But the reality is that we are not moving fast enough. There is an urgency. The commitments we've made at the previous UN high-level meetings on NCDs, nationally and regionally at the level of the heads of government, and the commitments we will make in the upcoming fourth UN high-level meeting must be translated into accelerated implementation and accountability. And I want to focus on that last word, accountability. We must move beyond words and into accountable action. The Caribbean has been a leader in the global fight against NCDs. From the 2007 Port of Spain Declaration, which set a precedent for regional action, to the ongoing efforts of our civil society organizations, including the HCC, governments, and the private sector, we have shown that small nations can drive big change. But we cannot do this alone. We need stronger global partnerships in an ever-changing geopolitical atmosphere, increased financing for the prevention and treatment, and bold policies to address the commercial determinants of health, including harmful marketing of unhealthy foods, alcohol, and tobacco. Today, therefore, I call on all of us, governments, civil society organizations, the private sector, and of course, our international health partners, such as the Pan American Health Organization and the World Health Organization, to recommit to this fight. Let us come together and prioritize and invest in prevention and ensure that the most vulnerable in our societies have access to affordable and quality care. Let us hold ourselves accountable for the commitments we make here today. As I said in another similar meeting in Geneva, prevention is not one option for the Caribbean and small island developing states. It really is the only option because we cannot afford the treatment. The time for incremental change has passed. Now is the time for a revolution in the NCD prevention and care. Our children, let me just drive that home. Our children, our economies, and our future depend on it. I will close my remarks here, and I look forward to a very engaging but action-focused webinar. And now over to the more important people that you're going to hear this morning. I will introduce you to Mrs. Maisha Hutton, the Executive Director of the Healthy Caribbean Coalition, who I know quite well. Dr. Karen Seeley, who is a member of our board of the HCC. Dr. Gloria Giraldo, the advisor for NCDs and Mental Health, the Caribbean sub-region of the Pan American Health Organization. And I have already spoken and recognized a significant contribution of PAHO to the NCD fight in the region. Ms. Deborah Chen, right next door in Jamaica, Executive Director of the Heart Foundation of Jamaica and Vice President of the HCC. And Ms. Maria O'Brien, Director and Chairwoman of MindWise. And I like the Gen Z nomenclature of Chairwoman. Ms. Michelle Baker, the Policy Coordinator, Global Climate Health Alliance and Healthy Caribbean Youth Member. If you've never heard about Healthy Caribbean Youth, Google it now and go on to our website. We'll do it after the webinar. And finally, Dr. Stanley Lalta, Research Advisor, Center for Health Economics at the UWI. And so let's get the action going and the ball going of accountable action. We now will have a presentation from Dr. Karen Seeley, NCD Leadership in the Caribbean. Karen, I'm really looking forward to hear the points that you highlight in this presentation. Thank you.
Get myself organized here. I hope I have the technology in order. Yes? Okay. Thank you very much, and a very good morning to everybody who is joining us on this important webinar as we go towards the fourth high-level meeting and UN high-level meeting on NCDs. This morning, I want to share with you the reasons for the pride we have in the Caribbean, about the Caribbean's role with respect to the NCD prevention and control, what I call the global campaign. So as we'll see in the next slide, Thank you. I was planning, in fact, to do two things, but Kenneth has clearly done one for me. And one was to identify why it is so urgent for us to be addressing NCDs at this time, and that he has done. So my presentation is going to focus on the highlights of the role of the Caribbean in global campaign for NCD prevention and control. So, as I said, here we've already done this with Kenneth. I would just emphasize the last bullet point, the big bullet point here, and that is that, as Kenneth said, we have not made progress in all areas. Our progress has been slow and patchy, and so we have to really proceed with accelerated creativity and innovation in order to have the correct policy interventions implemented in the region as we go along. So the next slide shows us where we are. I thought, although we're going to 2007 to 2025, I want here to remind us that, in fact, the Caribbean's role almost started from 2001, when the heads of government in their meeting in the Bahamas at that time declared that the health of the regions is the wealth of the region, and that should be region, not regions. And at that time, saw the need for there to be concerted effort, regional effort, in order to address health in 3 areas: HIV, NCDs, and mental health. And with respect to NCDs, in fact, they set up a commission, Caribbean Commission on Health and Development, that is chaired by Sir George Allen. It was launched in 2003, and the report that came out in 2006 was really important in giving action to the declaration of Nassau Declaration, and specifically facilitated the Commission's members being able to dialogue with cabinets, the various cabinets of the member states of CARICOM. And that was very important for the reality of the importance of NCDs was gradually recognized within the member states. It was then easy to see how the heads recognized that more needed to be done. And through the recommendations from various champions in the Caribbean, in fact, so the summit was held, the CARICOM Heads of Government Summit on NCDs was held in Port of Spain, hosted by Sir Patrick Manning, the then Prime Minister of Trinidad. And coming out of that was the NCD Summit Declaration, uniting to stop the epidemic of chronic NCDs. Now, this was the first time ever that heads of state had focused on this particular health problem of the developing world. And so it was recognized as being clearly demonstrating the leadership that the Caribbean could and intended to take. At the next slide, we see those are the ministers that were there that really rallied around this call for us to unite against the chronic diseases and stopping the epidemic of NCDs. It's one of the photographs that has now become historic, just as the summit was historic and just as the Port of Spain Declaration was historic. So as we proceed, we see where the Port of Spain Declaration did several things. It established, the summit and the declaration established the Caribbean's leadership internationally. Within the region itself, the declaration had 15 measurable commitments for reducing NCDs. And this was important because it facilitated a simple framework for monitoring and evaluation, which proved to be important in keeping governments accountable as to where they were with respect to their commitments on the declaration itself. We're also very fortunate that on the 10-year anniversary, around that time, that Professor Lafayette Samuel and Nigel Unwin conducted with their team at the Chronic Disease Center a 10-year evaluation. So we began to have, in fact, monitoring and evaluation from the very beginning, which was not something that we always have in the health and development sector. And the third important contribution that the summit made and the declaration made was within that the CARICOM heads of governments declared that the second Saturday in each September will be the Caribbean Wellness Day. This initiative has grown to the extent that countries very often now, CARICOM countries, extend this to a wellness week, and in fact build on this in terms of their health promotion campaigns. It's also important to note that it was adopted in the Latin American Caribbean region, the PAHO region, as promotion of a wellness week there. So several countries within Latin America also have a wellness week as we go forward. So there you see the impact of the summit and the declaration as we go forward. Next slide. I take us here to post-2007 and see here that in 2008, 2009, several things very clearly show the layering of increasing advocacy by heads of government, ministers, technical officers, to, in fact, have that NCDs identified as a development issue and placed on the UN agenda. This was specifically done in 2009 when the Conference of CARICOM Heads that was held in Guyana mandated, I was told unusual, mandated the permanent missions in New York to advocate for the special session on NCDs. And this was done on the premise that they could identify and substantiate NCDs as a development issue, because the UN at that level deals with development issues. And similarly, for the second time, NCDs, a health issue, was able to be seen as a development issue, affecting not just the health sector and needing not only the health sector for the, in fact, the solutions, but it having a whole of government approach that would have been needed. And so coming from that mandate in the July was followed in the September of 2009, during his statement to the General Assembly, Honorable Patrick Manning formally proposed for the convening of a special session on the UNGA on NCDs. That was really I should say, the starting gun for the missions in New York to get going with this mandate that was given to them in July. But also important to note that even before then, as you see, in the World Health Assembly in 2008 and 2009 at Summit of the Americas, the CARICOM countries as a group promoted and that one, NCDs should be elevated as a higher priority in the global health agenda and even reflected in MDGs, which was achieved, and that the countries should focus more clearly on very specific steps. And in Summit of the Americas, it was in fact on surveillance and on planning for the coordinated approach to establishing commissions. So by 2009, activities were started in the UN at the New York level. And the next slide, we see how many things, in fact, had to be done as we got towards that high-level meeting. The meeting itself, as you see in the red below, was held in September of 2011. But first, I will tell you, and I'm able to tell you from actually participating in it, we first had to educate the diplomats about NCDs as a public health and development issue. We then had to sensitize and convince countries that it was important enough to have a special session on NCDs. And when that came along and we were able to get, therefore, support for a resolution for a high-level meeting, we knew that, in fact, we had achieved something very significant in terms of bringing to the focus NCDs as a development issue going forward, seeing it, therefore, as not a one-off process or a one-off meeting that is necessary. It needed to become part of the UN development agenda. So as we see in as I continue to just emphasize, between 2010 and 2011, every meeting, the CARICOM participants in meetings promoted the idea. We got the support of the UNSG, we got the support of the G20 countries and their summit, and so we were building the momentum towards holding a successful 2011 UN high-level meeting. In the next slide then, we see the fact that we are now here in 2025. I wanted to make the point that one of the achievements for CARICOM in getting to the point of the first high-level meeting was to get into that political declaration that there would be reviews of the outcome document, the political declaration of 2011. That was not, in fact, supported at the beginning, but with a persistent advocacy it was. And here we are. We are on to the third UN high-level meeting after the 2011 meeting. There were different themes, and as you see from the themes, trying to emphasize what was deemed to be the critical actions that were needed at the various times. And in 2025, we are focusing on equity and integration, transforming lives and livelihoods through leadership and action on NCDs and mental health. So where are we here? Next slide would show us that we have, in fact, achieved several things in the Caribbean at many levels. And I think this is important for us to note that although we say the progress has been slow, the achievements have been patchy, we really have to note the significance and what it took to get to those achievements that we can here identify. And I have just selected a few at the global level, the regional level, and some of the national levels. At the global level, we see continuous participation, engagement of our CARICOM heads of government. We have CARICOM heads of government and ministers of health participating in the WHO Global Compact on NCDs. We have heads of government and senior technical people participated in the WHO World Bank financing of NCD dialogue that took place last year. And we have CARICOM heads of government monitoring almost at least annually at one of their meetings, the progress in achieving the regional NCD initiatives that have been approved as we go forward. We also see that we are demonstrating the multi-sectoral action at the CARICOM level, where we've had several, and this one that I noted here is joint meetings between the different conferences, COTED and COSOD, the Council of Trade and Economic Development, the Council of Health, Human and Social Development of CARICOM. And one of the key decisions approved then was the elimination of trans fats, industrially produced trans fats. We'll hear how much progress we've made there. At the regional level, we have what we now fondly call Caribbean Moves. This is an initiative that was adapted from the successful campaign Jamaica Moves, and the heads of government adopted it as a regional effort for them to focus on and to be able to improve the effectiveness and efficiency of the health promotion efforts that have been being made. We also see that we've worked on the integrated NCD surveillance systems. Our regional partners, CARFA, PAHO, and CARICOM, developed this regional system, and this is now being used increasingly in the system, allowing us to compare across countries much more easily. We also have others at the country level. On the next slide, we see that in addition to this is another example of what took place at the regional level, and that is the CARFA 6-point policy package for food security. And that has now been gradually introduced into countries as a result of training and as a result of support from our regional technical partners. And many countries took steps very specifically to improve their program and to improve their monitoring of what is happening in the countries. Many countries have done the WHO STEP survey. I just note here two most recently in the Cayman Islands in 2023 and Trinidad and Tobago in 2024. And in Trinidad and Tobago as well, there was a focus on the community level support that would be needed and successful implementation of HEARTS, which is a program for the prevention, treatment of cardiovascular diseases, engaging the patient and the community as a whole. And I learned very recently that this is now available in all of the health centers in Trinidad and Tobago. Barbados focused on, as many countries did, I'm just noting here one, on developing further their strategic plan with the emphasis on the educational and community programs that are necessary. The Barbados School Nutrition Policy has been implemented. So here is just snapshots of what has taken place to demonstrate there have been achievements. According to many of these things, you can in fact see how they align with the commitments in the high-level meetings, but there's much more to be done. And in the next slide, we see, I'm beginning to wind up here to show you, I wanted to do a couple of things as I get to the end. One, I really want us to see that the Caribbean leadership for NCDs has been at the political level, the technical level, and with strong effort from the regional level, including even the civil societies of the Healthy Caribbean Coalition. That is very important for us to understand and to really appreciate, and given what it takes to get regional groups to maintain attention to a particular development issue. The other slide shows the other thing important in terms of the leadership of the Caribbean in NCD campaigns. We have developed partnerships with a wide range of partners, civil society organizations, and civil society organizations that work not only with civil society, but also with the member states in terms of meaningful engagement so that the community is involved in the policy development and implementation. UN partners, you notice that I have in red here, PAHO and WHO. Pan American Health Organization and World Health Organization are our partners. First call in terms of the efforts that are being made in the Caribbean region in this regard. And our international partners, just giving you an idea of the number. I'm sorry for the acronyms. I couldn't spell it all out on one slide, but just to get an idea of the number of partners that we are working with in different areas related to NCD prevention and control. And in the next slide, I want to identify some of the factors that would help and have helped and would help even more to us to have effective Caribbean participation in high-level meetings, in particular the next high-level meeting. We have learned from our participation and leadership in the previous ones that it's important for ministries of health and civil society in countries to understand what the UN process for high-level meetings is all about. They include negotiations, outcome documents, resolutions, side events. The ministries of health, CSO, and all other related relevant NCD sectors need to know how that works and how it works between the UN and the UN system in New York and their diplomats, and what happens in capitals in the ministries of health. It also is important that there's priority given to the UN process by ministries of health, and the ministries of health develop and have a close relationship between themselves and the ministries of foreign affairs. Ministries of Foreign Affairs are guided by capitals in any technical area of relevance. And in this case, with NCDs, it's the Ministry of Health. Then we need to have meaningful engagement of civil society organizations. We know how important the CSO regional meeting in 2018 was. We are still trying to find out what should be the mode for us to achieve the same objectives we had there. But we need also to have civil society organizations involved in the Ministry of Health and the government's preparation for the UN high-level meeting, and if possible, including representatives of civil society organizations in the delegations to the high-level meeting. Side events are important in advocating for particular issues around a high-level meeting. And the side events could be sponsored when they're sponsored by countries or regions, especially with CARICOM. We have had high-level sponsorship that is very much noted by the countries at the UN level. And that what we want to see, though, is that in those side events and in other side events, we have CARICOM representation. So we have willingness to, in fact, invite the CARICOM technical officers, ministers of health, to be part of various panels as they go forward between now and the high-level meeting. And finally, from the past experiences of the high-level meetings, we learned from the 2011 and the 2018 UN high-level meetings that it was extremely valuable to have a focal point in New York that is available to provide technical support to the ambassadors, the permanent representatives in New York, and to help with the coordination that is required among the CARICOM countries in New York, as well as what's happening in capitals, as well as with the regional organizations that's so critical in providing the support to the CARICOM member states. And as coming to the end, I think you would agree with me, as once noted by Sir Trevor Hassel in 2011, that it is clear that progress, notwithstanding the fact that it is at the level that we would have wished, that what we do in the Caribbean and CARICOM region demonstrates that we are punching above our weight as with respect to being the CARICOM small island developing states in the development issue of non-communicable disease prevention and control. Thank you.
So thank you, Karen. I know that was a very difficult task when I saw your time allocation, but you did a fantastic job. And I know that there's several points that we can dissect here, but I know we have to move on to the next presenter. But certainly you have highlighted the importance in terms of the armamentarium moving forward of both leadership and partnerships. And those two slides, I think, are pretty important for us to consolidate on. And what also struck me was this knowledge of the algorithm for action to UN high-level meeting by the ministries of health. That's something tangible that we can also address, especially CSOs. You know, how do we get our MOHs on board and prepared so that they can best utilize that time? You also mentioned as an important partner, Pan American Health Organization. And our next presenter is Dr. Gloria Giraldo, who is the advisor, NCDs and Mental Health Caribbean Sub-Regional Office, PAHO, and who was actually in this building 2 days ago, right, Gloria, when I highlighted the importance of PAHO. And I will now invite her to deliver her presentation on a brief overview of the advocacy priorities. Thank you.
Thank you and good morning, everyone. And thank you very much for the Healthy Caribbean Coalition for your invitation. And you may not imagine the honor that it feels to be doing this presentation here in the Caribbean, but also the immense sense of responsibility because I recognize the importance that the Caribbean has had in a global scale. And even when I was in other geographies, in other countries, in other areas, this is always brought up, the importance that the Caribbean had in making this a global priority. I will be presenting some of the data that we collect from all of the member states, and I will be focusing on the Caribbean specifically. So please allow me to bring up the presentation. Here we go. And now swap. Okay. This highlights of NCD progress based on recent monitoring data is based, again, as I mentioned, on the data that is provided to PAHO by our member states. And if anyone in the audience has had any doubts of why we are here today talking about non-communicable diseases, this is a slide that shows us that the proportion of deaths due to communicable diseases, non-communicable diseases, is reflected here in green. Please see the overwhelming presence. Of course, we can see the difference. Of course, we're very happy that that it's not affecting children, and unfortunately, that under the 5-year-old mark, it's of course maternal perinatal nutritional conditions. And then the gray is external causes which greatly affect our populations. This is for the Americas. This first slide is for the whole of the Americas, but just to underscore the fact that non-communicable diseases, of course, become as in the life course and in the most important cause of death. And I'll probably be showing other, and it got stuck. Okay, this is the second one. The mortality rates, and this is 2 decades. And this is, again, I know this is for many bread and butter for many of you in the healthcare field, but understanding the mortality rates also tells us the disparities that we also see among sub-regions, even within the Americas. So as was also in the introductory remarks by Dr. Connell, we do see here the denomination of non-Latin Caribbean, the here towards the end of the slide, towards the right-hand side of my right-hand side, we see that non-Latin Caribbean countries, or the English-speaking, Dutch-speaking, French-speaking countries, have a very high rates of, again, the light green here are the non-communicable diseases. And you can see then the different subregions in the entirety of the Americans, and also compared to the countries of Brazil and Mexico. So of course, it is a priority for the entire continent, but it is a very dire priority for the Caribbean. This is another way of showing similar information. I won't dwell on that. We see our subregions, and we see excess mortality rate, another epidemiological indicator showing that our English-speaking Caribbean has a lot of work to do. So in this preparation for this landmark meeting, what is it exactly that is being assessed? Well, I always bring this slide because I think models help us think and deal with complexity. And non-communicable diseases are very complex, and we know that. It's not one factor is multifactorial. But what we all are trying to do is to impact the environments that end up conducing to those risk factors that ultimately lead to the NCDs. So we want to impact the tobacco environment, the physical activity environment, the food environment, and the alcohol environment. Therefore, we assess that with different measures, and we monitor how member states are doing towards working towards regulations to change those environments. One measure is the risk of dying prematurely. This is one measure that is utilized, and basically this tells us what is the chance of a 30-year-old man or woman in a region or in the Americas, the chance of dying from any of the non-communicable diseases before reaching his or her 70th birthday. These are the data for men and women in the entirety of the region of the Americas. So we see approximately in 2025 a 16% for males, a chance of dying before the age of 70. For women, it's a little bit lower, which is good. The target, though, that we are striving for is to get down for women to less than 10% of a probability, and for men of less than 14%. That's for the whole region of the Americas. Let's see for the Caribbean. So here we see not very encouraging news that a man in the Caribbean at age 30 has a chance of dying from any of the 4 major NCDs before reaching his 70th birthday. And similarly, women, which is lower, at 12%. So these are one of the indicators. So this is what the epidemiologists have come up as a measure to show how are we doing towards avoiding that premature mortality. And as we can see, there is quite a bit of work to do. That is one of the indicators that's being assessed and countries will be assessed at in the UN high-level meeting. Now, the overall NCD Global Monitoring Framework, which included that one indicator I've just showed, but it also includes how are we dealing with both the risk factors, some also of the more physical risk factors as well as behavioral, and also how are countries starting to do in terms of treatment. So these were the 9 voluntary global targets that all member states that are part of the World Health Assembly in 2013 passed this global monitoring framework. And so what do we have? We have that countries were committing to reducing insufficient physical activity by 10%. Also, that raised blood pressure would be reduced by 25%, that harmful use of alcohol would be reduced by 10%, that tobacco use would be reduced by 30%, that salt intake will be reduced by 30%. So these are still the commitments that we are all working towards, and that countries in the area of treatment and provision of care, that people that under eligible coverage would be receiving the necessary medication and counseling for their NCDs, that 50% of the people, and that 80% of the facilities would have availability of essential medicines and basic technology. So these are the targets. All countries committed and are working towards this. And for those, WHO and PAHO offer the best buys. And these are interventions that are scientifically based, that have shown to reduce and to have an impact. And these are related to the risk factors I just mentioned. And these are only examples where we have familiarity, the risk factors such as tobacco use. What are some of those best buys or cost-effective interventions? Well, health tax increases, smoke-free indoor places, smoke-free environment, health information and awareness, bans on tobacco advertising. As you know, the entirety of the Framework Convention on tobacco, harmful alcohol use. What can we do about that? And physical inactivity and healthy diet, where there are proven scientifically based best buys, such as reduced salt intake on food, replace, as was mentioned, elimination of trans fat, and different other interventions. So how are our countries doing towards those indicators? So these are visuals that are meant to show you with color. They're color coded, where green means substantial progress or on track. Yellow, fair progress, where acceleration is needed. Orange, limited or no progress. Red is actual deterioration. So this is based on the data submitted by our countries, and we do see there is a very high level of red, meaning that the regulations, best buys, leading towards this, the ones on modified risk factors, the biological risk factors, are not yet, we're not really making progress. We see very little green, and we see some yellow. All this information resides in the PAHO NLACE data portal. So everything can be publicly accessed. If we aggregate that, this is by number of countries. Again, the same, this is based on the chart I've just showed you. So, but this shows us a collectively, we see that only some of the, about 3 countries are, are in green in terms of the alcohol per capita consumption. And some countries are in green in the current tobacco use in adults. This is based on, summing up the number of countries that are taking steps towards those modifiable risk factors. Similarly, in regards to, for example, raised blood pressure, blood glucose, we see here again that the majority of the countries need to implement or scale up. So we absolutely recognize the immense effort in the commitments towards the Hearts Initiative and many steps, the development of the clinical pathways. But now we're at the moment where we need to scale up and to do the quality improvement that is necessary so that the interventions are provided with quality. This again, all accessible in the portal NLACE. This shows us where we are and specifically each of the items around tobacco, alcohol, healthy diet. And to close, very sobering data, overweight and obesity in children, the past trends and the forecasting towards the future. These are some of the countries and the region of the Americas. Again, not all the countries, all accessible on our data portal, but we just continue to see the upward trend on childhood and adolescent obesity. Therefore, this is, as it was said by Dr. Connell, it's a call to action and urgent action that needs to take place because we need to decrease the pace, the fast, rapid growth of these conditions. We will be probably in the panel talk about some of the solutions, as it was mentioned before, but thank you for your attention. And I hope at least this is a sobering perspective that can also fuel our sense of urgency to move forward towards action. Thank you very much.
Thank you, Gloria. And it was indeed a sobering presentation in all senses. The slides were excellently presented. So thank you very much for that presentation. Before we move on to the next presenter, Maisha Hutton, I want to invite everyone joining us on the webinar today to take a look, go and Google it, the WHO Best Buys document, and to have a look at the evidence-based interventions that are mentioned within the document. Quite often we think that we have the public health solutions just because it feels right. But look and see what are the evidence-based best buys in that document. I will encourage everyone to do so. Thanks, Gloria, for that presentation. And moving on to Maisha, a brief overview of the advocacy priorities. Now, Maisha, you have 10 minutes, but no pressure.
I will keep to time. Thank you very much, Dr. Connell. Hello, everyone. Thanks for joining us. And I'm glad you've heard from Dr. Connell, Dr. Seeley, and Dr. Giraldo. And many of you know that in preparation for the high-level meeting, HCC comes up with a series of advocacy priorities, really based on civil society's contributions and feedback. And these priorities are meant to inform CARICOM priorities for the high-level meeting, for the political declaration, and for the priority actions beyond 2025 as we look towards the SDGs and the 3.4 target around NCDs. And these priorities are informed by the Global NCD Alliance, our parent organization, and we arrived at these priorities through a consultative process. And I wanted to just look back very quickly, inspired by Karen's presentation, on what we did in 2018. And you'll see on the bottom left-hand side, and many of you civil society organizations, as well as our colleagues in public health, in the public sector, we arrived at these 9 priorities, which came together at a meeting endorsed by, at all levels across the region, civil society, our local governments, and then at the very highest of the regional level, and arrived at a consensus around these priorities. We then worked to develop a briefing document for the Ministries of Foreign Affairs to support their negotiations in New York as they led the CARICOM inputs into the political declaration, which Karen described so well earlier in her presentation. And as a result of all of that advocacy, we ended up getting the priorities endorsed in the communique emerging out of the July meeting of heads of government. And this was then, again, as I said, used to inform the negotiations. We had a regional campaign, and we had representation of the Caribbean at the multi-stakeholder hearing, which is a hearing where civil society comes together to share their priorities prior to the completion of the zero draft of the document. And Karen also, Dr. Seeley also would have mentioned a high-level side event. And these are photos from the side event that we had launching Caribbean Moves back in 2018 at the 3rd UN high-level meeting. So switching forward to the current priorities that we've put together in consultation with our membership, I wanted to start by saying that these priorities, as Kenneth just mentioned, the WHO best buys, they're informed by these global recommended evidence-informed high return on investment inventions. They reflect and support our global advocacy priorities. They are informed by CARICOM national, regional, NCD frameworks, plans, and commitments at the highest levels. And they're informed, importantly, by key factors and realities which exist in our context. And I want to just reinforce this idea of priorities. We're cognizant that we have significant resource limitations, we're highly vulnerable, and because of that, we must identify priorities in which we focus and laser focus our investments. And these priorities have to be driven by an intention to prevent, first and foremost, increases in the occurrence of NCDs and their risk factors, and equally as important, to measurably improve the quality of life of people living with NCDs. So with that in mind, these priorities were developed, again, to support the CARICOM negotiators, to represent the priorities of civil society, governments, and key implementing partners. And so we arrived at 12 priorities after extensive consultation. And these priorities represent the needs and priorities of civil society organizations, as well as our partners. And they're meant to be a menu from which we pull. And the first priority is around putting people first. And as a civil society organization, it's no surprise that this is the priority that headlines our list. And so we're talking about engaging communities, putting people first in the NCD response. And this means developing mechanisms for meaningful engagement and investing in civil society, enhancing health literacy and public health education, and empowering people to demand evidence-based policies. The second priority is around the commercial determinants of health. And there's increasing focus on this idea that there are factors which are negatively influencing progress, and in particular on NCD prevention. And so addressing the commercial determinants of health really necessitates strengthening NCD and public health governance to tackle policy interference by actors with vested interests, actors whose interests are not primarily public health. And so this involves developing a public health playbook and really focusing on developing tailored tools for our small island development context, which helps us to prevent, manage, and mitigate conflict of interest, and using other critical tools such as freedom of access to information legislation. The third priority is around healthy food environments, and this sits very high on our priorities because we know the data is very clear now that amongst the risk factors for NCDs, unhealthy diets is the leading risk factor contributing to obesity and NCDs. And so tackling food environments is a high return on investment measure. And so when we think about this, we think about octagonal front of package warning labels, and these are all evidence-based. I go back to Dr. Connell's comment about really informing our action by evidence-based WHO best buys. Fiscal policies such as taxation on unhealthy foods, ultra-processed products in particular, and subsidies on healthier foods to make them affordable. Procurement policies that support climate resilient local farming so we can share those pathways of produce to our communities, regulating the sale and marketing of ultra-processed products to children in school settings, eliminating the industrially produced trans fats, and ensuring healthy food and beverage in times of donation and crisis. And then the fourth one is around the tobacco and nicotine and smoke-free. And our emphasis here is really on prioritizing those best buys, in particular tobacco legislation and taxation, integrating vaping, so electronic nicotine delivery systems. And we all know that this is an incredibly pressing issue, especially amongst our young people. Number four, the data that Dr. Giraldo would have showed you is that we're underperforming significantly in the area of physical inactivity. And so how do we strengthen our communities and our built environment to support increased physical activity? Alcohol, again, one of the most under-focused of the risk factors, and we need to do better in this and accelerating the implementation of alcohol reduction and cessation policies, especially against the background of ever growing evidence that there is no safe level of consumption of alcohol products. Mental health services, we learned out of COVID that we need to focus our health systems on delivering mental health services and strengthening these services. And so an entire priority is dedicated to strengthening mental health services. Cancer, in particular, eradicating cervical cancer. We know that there's a global plan to do this. And we have the tools. We are a small setting, and we would like to focus in on this. In addition, though, we realize that there's significant death and disability caused by other cancers, breast, prostate, and colon. And so those are also included in this AP. 9 is a robust priority. It's strengthening health systems. And critically here is we want equity and rights-based and climate resilient health systems. And there are a number of specific areas under there dealing with primary health care, access, again, climate resilience, integration around disasters, emergencies, and pandemics, strengthening our health workforce. We know that's an ongoing challenge for us, leveraging digital transformation and artificial intelligence. And then coming close to the end, breaking down silos, definitely not incredibly important, so not close to the end because it lacks importance. This is critical, and we're talking here about mechanisms for multi-stakeholder collaboration, policy coherence, always taking into consideration protection of policy-making spaces from vested interests, so those conflict of interest safeguards, and then strengthening platforms for knowledge sharing, partnerships within the Caribbean and across like areas such as the small island developing states. Mobilizing investment. We know that, as Dr. Connell mentioned earlier, we are consistently under-resourced when it comes to treatment. And so we need to do better in terms of resource allocation. We need to be innovative. We need to be as much as we can, self-reliant. We also need to draw on external sources of funding, access other the platforms such as climate. And so innovation is really going to be needed in this area. And also using tried and tested. We know that fiscal policies such as taxation on unhealthy commodities, we know that those work, and earmarking those for NCD treatment and prevention. And finally, accountability. And, Dr. Connell landed and ended his opening remarks on accountability. Accountability is incredibly important. We need to strengthen our mechanisms and metrics for accountability. When we think about data collection, analysis, monitoring, evaluation, and reporting at all levels, we need to ensure that we include key groups such as civil society, people living with NCDs, young people, those with disabilities, and all of those in situations of vulnerability in these accountability mechanisms. And we need to at all times safeguard these mechanisms from conflicts of interest. And as promised, Dr. Connell, within my timeline. Thank you.
That's excellent, Maisha. And you caught me off guard as I was taking a sip of coffee. But really glad to see this presentation because I also know the journey that HCC has taken in prioritizing these priorities. And, even as you presented them, it is quite easy for anyone listening to see the NCD response as a personal responsibility. It is very easy because, you make a personal choice. What I think we need to convince this audience, it's more than just a personal responsibility. It depends on where you live. It depends on the healthy food you have access to. It depends on your ability to exercise. All those things are not dependent only on your personal choice. But what is dependent on your personal choice is some movement. So I'm going to encourage you to get up and move as I hand over to Danielle, who is going to be doing the Mentimeter. Don't move too far, by the way. Get some water, rehydrate, but answer the Mentimeter. Danielle, over to you.
Thank you, Dr. Cullen. You know that's quite appropriate as I am always a huge advocate for movement. So definitely encouraging everybody to use this opportunity to take a quick standing break. And it's lovely to see everyone. We just would have heard from Maisha about our advocacy priorities, and we really want to understand how they resonate with you and the work that you're doing. So I'm inviting everybody to please scan this QR code. And we're going to do a quick activity together, a little vibe check. And Doriel, thank you so much for posting that Mentimeter link in the chat. So you can either scan the code using your phone or you can click on the link in the chat, and it'll allow you another minute or so to get all registered. I'm already seeing some people in, which is great. Excellent. And as you're waiting, again, you can take this time to take your standing break. Okay, waiting for a couple more people to join. So again, you can either scan the code or you can click on the link in the chat. All right, so we'll go ahead and get started. We have a couple people in. Great, 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 great. Okay. So our very first question, so Maisha would have shared our 12 advocacy priorities. And we really want to understand from you, based on your area of work, based on your passion. I know she framed them as all of these are priorities, and that's how we need to really focus in terms of next steps in approaching this high-level meeting. But we'd really like to understand from you how these resonate with you. So feel free to click on that priority that, again, really resonates with you based on your work, based on your passion. Hi, Virginia. Yes, we can repost the link in the chat. Ooh, action. Okay. So I'll probably have, I'm sure once I'm done with this, Dr. Connell might have some thoughts, but we have strengthening health systems coming up significantly at the top. Accountability, excellent. Physical activity, as it should be, again, based on that data, healthy food environments. Great. Okay, this is helpful. And again, I know this is a reflective of the work that you all are doing, whether in the civil society space or in the public health sector space, your passion areas. All right, healthy food environments is on top. Let me see if there's any more movement. And I'm hoping our panelists are also taking note of kind of how everything is falling. Yes. All right. I'm going to move to the second question, but maybe we can take a screenshot, Dr. Connell. I imagine you're going to want to comment on this when we return back.
For sure. Give me a few seconds. I'm going to screenshot it.
Perfect. Okay, I'll allow you to do that.
I've got it. Go right ahead.
Okay, excellent. And I'm really glad to see, again, putting people first coming up in that top 3. Thank you all so much. Our next question and last question, we're going to ask you for a little bit more. So seeing as clearly the priorities resonate with you, they align with your work, how can you see yourself amplifying the priorities. And we're talking even just realistically, like, do you have upcoming events where you can see yourself integrating these into your work, upcoming campaigns, even on a personal front, integrating these into the work that you're doing? So I know this one requires a bit more thought, but will allow you that. And again, we're just keen to hear how you think. And of course, suggestions for us too, of ways that we can continue to integrate and engage with our broader civil society and other partners in amplifying these priorities, especially ahead of the UN high-level meeting. So I'll allow you a few moments to have a look at this one. Okay, great. So we're seeing stakeholder, okay. So HCC team, we're getting some ideas here. Stakeholder consultations with the Ministry of Health, Ministry of Education, continue to mention it while in meetings, workshops, strengthen policies for access to medication in the region, promoting, educating, respect to healthy foods, strengthen collaboration with non-traditional partners, eliminating silos. Brilliant, brilliant stuff. So hopefully these are ideas for us, but hopefully these are things that you all, again, are seeing that you can kind of take on in terms of collective ownership of these advocacy priorities. Ooh, inviting HCC to speak at online events. Excellent. And we are, and I'm sure we'll get to this, but we will have material that can be easily shared and amplified that we're hoping that everybody, again, can use. Okay, excellent. I'm going to stop here. Dr. Connell, turning it back over to you, but we have quite a bit of audience information that we can work with.
Oh, definitely. This has been quite useful, and I've just adjusted my screen, Danielle. Do you want to know why I've adjusted my screen?
Tell me.
I'm on my step machine. So I took your advice.
Excellent.
So I am getting some movement in this webinar, and I'm excited. Hopefully the panelists are also moving as well, because we're going to jump right into them as we move into the panel discussion, which is what I suspect many people are waiting on. The objective of this discussion is really to describe the vision of NCDs in 2025 and beyond, highlighting examples on ongoing efforts and success stories in the NCD prevention, control, and advocacy within the Caribbean region, and also highlighting potential progress or setbacks if advocacy priorities are not addressed. So this isn't an abstract discussion, but accountable action has to come out of it. And so I'm going to welcome the panelists to give brief interventions, but really to respond to some of the things I think have already come up in the questions. I'm going to ask the first response to come from Mrs. Debbie Chen. So Debbie, you're here?
Yes, I'm here.
Yeah, good. And all of our other panelists are here as well. So Debbie, you're right across the street in Jamaica. And, based on Paho's presentations, glorious presentations, the Caribbean NCD situation remains quite dire. NCD policies and programs, including the commercial determinants of health and conflicts of interest, continue to be very challenging, to say the least, right? What should be prioritized moving forward to address these issues?
Yes, so I was happy that Maisha mentioned conflict of interest and the commercial determinants of health, both of which tend to be tied up in each other. I mean, I think in all our societies, we have seen examples of conflict of interest, which means that there's an incompatibility of our interests. We find that our policies are often derailed by those who have vested interests. And the policymakers, unfortunately, sometimes go along with this. We don't have strong campaign financing laws, for example. It's difficult for us to know what's going on behind the scenes. We do see in the media examples of donations being given of ultra-processed products to persons, to health institutions sometimes. And sometimes we see donations to constituencies of members of parliament. So this is where the conflict of interest comes in. I noticed that well, one of the things, if you go on the Healthy Caribbean website and you go to publications, you'll see an excellent publications about it is for the policymakers, and it's about conflict of interest, and it's geared towards policymakers in the public sector. I think it's an excellent publication, and I think that at the end there is a list of things that can be done. But I think if the government's different agencies, not just health, could use that publication in determining how best that we can mitigate. What we should be basing our public health policies on is on evidence, not on those vested interests. And we expect private sector to look out for their bottom line, but government should be looking out for public health interests. And I must say, it's not all private sector groups who are trying to derail public health policy. Some are making, steps to reformulate and so on. But what needs to happen is that we need to have the government being more aware of the conflict of interest. And you mentioned earlier about policies as opposed to personal choice. Personal choice will get us so far, but no, on a population level, we need to have policies.
Yeah, Debbie, it's easy to make these, I'm just using this as an example, pronouncements. We need policy, and we need policy on conflicts of interest, but we live in small and developing states where we rely quite occasionally on funding for many of our health activities. How do we address these questions, or this question, in SIDS?
I think that we just have to stick with, even in my own organization, you have to stick with companies, organizations, products that are in keeping with their mission. So you can't be the Heart Foundation of Jamaica and you have a sugary sweetened beverage headlining your Heart Month activities. That is giving the wrong message. There are many companies in the countries that have many other products that are not harmful to health. And I'm sure that if we were to engage them, they would get on board. We need to move away from this thing of funding only coming from the ultra processed product industry. And it doesn't have to be that let us say a company that sells cars. That may not impact health directly, but as a corporate social responsible company, they could also help to sponsor some of these activities. And also, if you look at the health costs, I know it's long-term, but the health costs of NCDs where they are is going to be tremendous. So it is a very short-sighted thing to think, oh, well, we'll go along with the UPP industry and then, for short-term gain, whereas long-term is going to affect the economy.
So if I could summarize that last point, then it's really people over profit or funding.
Absolutely.
In this case.
Absolutely.
Yeah.
And evidence.
So that's kind
evidence.
And evidence. Yeah. So I'm going to move into the care delivery setting. And Gloria, I know this is your area. This is close to your heart, pun intended, right? But what is the importance then of emphasizing the importance of strengthening primary care? Because primary care is really where it's at in terms of prevention.
Absolutely. And as it was shown earlier, so we have a lot of work to do. We know, and you said it, prevention is of the utmost importance. However, in our current situation, we already have people in many of our Caribbean countries, over 40% of the population, of the adult population, suffer from hypertension, high blood pressure. We have over 12% and higher. I'm not looking at the data right now in front of me, but of diabetes. And those also bring complications. So we have a very large segment of the population already suffering. Any one of us can think of a friend, a family member, or even ourselves. Therefore, investing in strengthening primary health care is exactly where we can have an impact with proven evidence-based interventions. And we have not only HEARTS as the entry point into the systems, the HEARTS initiative, which is meant to deal with cardiovascular health through very practical, doable interventions that a primary healthcare team, so we're speaking to your primary healthcare nurse, to the primary healthcare physician, and we are coming in with better care for NCDs, which is also how do we work within the primary healthcare system when the patient comes in and is a woman and needs to be screened for cervical cancer. So how our primary healthcare teams will have the tools within the system, and we're not having to send them to secondary and tertiary care, which is so expensive. So
and
how do
delays
we
as well.
deal? How do we deal with it at that level, at the community center that is it within my community, where I can go, where I will be assured access to the right medications, I will be assured to the right quality, high quality care. That's what we're striving for, and that's why we're working with ministries of health to improve that primary healthcare level.
I guess what I'm hearing from you, and I know that I'm going to ask you something about hearts, is there is an opportunity for opportunistic screening and management in primary care. If you go for a cervical cancer screen, you should have your blood pressure checked. The doctor should check your HbA once there's some monitoring of your diabetes. You should monitor for risk factors such as that, as obesity, and you should address things such as smoking cessation. Everything has to be captured in the visit. Do you want to speak more about, I guess, a more holistic approach to primary care?
Absolutely. And I think anyone in our audience who is a primary healthcare provider would relate to, you are looking at the whole person. So you're not looking at a disease. But if we have the right tools, so the person that just walked into my consult is a person with hypertension. Well, here I have a clinical pathway in which I don't have to guess. Or not guess is probably not correct. I don't have to think through what is for this person. I have a standardized treatment protocol for this person. And that saves me time, and I can see this patient efficiently. I will then have that person come in for diabetes, and I will have a diabetes clinical pathway that can help me. Similarly, as you mentioned, opportunistic type of screening, because we have over 50% of people with hypertension walking around in our communities, and they don't even know they are walking around with hypertension. And all of a sudden they will come and debut with a stroke or heart attack. So we know that. So looking at what is patient-centered means that we are looking at that patient, but having the tools for primary healthcare teams so that they can act upon in a way that is efficient and a way that is of high quality. And that's what we're trying to engage with the better care for NCDs.
And which is evidence-based as well. Of course, all of this costs money. And so there needs to be some funding for NCDs and NCD management. So Stanley, I know that you're having some technical problems, which is why we can't see you, but we'll trust that you are not an AI-generated voice. Mobilizing investment is critical. CARICOM leaders have committed to fiscal policies, such as taxes, and I'm told in one country, at least in the recent budget, these were mentioned, on SSBs and maybe even salt and other health-harming products. What have been the regional successes in implementing these policies?
Good. Thanks, Chairman. And so to you, Chairman, colleagues, and participants, I'm going to make a concluding comment before I really say a bit about what you specifically asked me. And I would say that when you look across the Caribbean, where taxes are concerned with these particular products, the glass is 1/3 full and 2/3 empty. How did I come with that? If you look at the Port of Spain Declaration, if you look at the Port of Spain Declaration and the commitments which have been made, we have 20 Caribbean countries. In terms of this sugar beverage tax, just 7 of the 20 have actually implemented some kind of tax. And even when you begin to look at the tax that has been implemented, you have some big questions about looking at the differences. The date of implementation compared to 2007 as the baseline, the range of products which are covered. We're speaking about juices, drinks, concentrate, syrups, Have we excluded products themselves, like candied products? Have we excluded milk-based products? Have we excluded or included chocolate-based products, for example? So there's a range of things one can consider under that. The magnitude of the taxes have varied across the countries which have implemented, and these countries which have implemented something like Barbados, Belize, Bermuda, Dominica, St. Kitts, Nevis, St. Vincent and the Grenadines, Suriname, Antigua, and Barbuda. So the range of products has been different among the countries. What about the magnitude of the tax? Except for Barbados, which is about 20% recently, most of them are around 10%. Is that meaningful or not meaningful? Is that desirable compared to what PAHO or what WHO would have recommended, or how far are we from that desirable target? You look at the design of the tax itself, there are differences in the countries. Some have looked at it by volume. It's a volume-based tax, like per liter. Some have looked at it by value, so it's monetary. Some have looked at it probably by sugar content. Is there best practice which should be emerging coming out from this? And then what percentage of the funds which have been collected from these taxes actually come back to health? So comparing among countries, there has been some movement in 7, 8 of the 20 countries, but there are differences. What does this mean altogether in terms of impact? Are they having an impact? Well, impact analysis studies have been very, very limited, except for Barbados, which has been a bit more rigorous in some of the analysis. Most of the other countries have not yet done so. Impact on utilization, much less proportionate than what the 10% or 20% increase in the tax has been. You know, like in Barbados, about 4 to 6% reduction in consumption of sugary beverages. Those beverages were the tax that have been imposed. In other countries, is that good enough? It's much less proportionate than 10%. Should it be higher than that? That's where the elasticity of demand considerations have to be considered and taken on board. So there's a role for our evaluation and for research to help us with that. Has consumer behavior changed considerably? Are they consuming more healthy products, water, for example? Some of that, as I said, the rigorous evaluation only in Barbados, not in the other countries. Have producers changed their behavior? Have policymakers changed their behavior? So all of these are aspects which have to be considered, and much more rigorous research analysis has to be considered in this.
Stanley, I'm going to stick a pin there because I want you to reflect on an important question that is very heavy on social media now in Barbados, and that is you can't tax people into behavioral change. And then I'm going to change over into climate, and Michelle, get you into this conversation. The impact of climate change is cross-cutting NCD care, including mental health, of course, food and nutrition, security, health system strengthening. Now, you would have recently attended COP29. What key priorities should we focus on to maximize the impact of climate on NCDs?
Thank you, Dr. Connell. So I want to just highlight the connection between climate change and health in this conversation, because as we've seen, climate change and more importantly, climate inaction, because it's not just about the changes that are happening, but the inaction and the lack of ambitious progress that is worsening the NCD epidemic that we're already facing. So there are just a few key priorities that I would like to highlight coming out of COP and just in these NCD spaces. So firstly, multi-sectoral collaboration and policy coherence. We need stronger collaboration between climate, environment, and health sectors. And as we've seen, the Caribbean already faces high obesity and NCD rates due to an unhealthy food environment and low physical activity. And climate change only stands to worsen this by reducing our crop yields, by making exercise harder in extreme heat, by disrupting our already fragile and unfortunately our importation-reliant food systems. Secondly, I would like to highlight the importance of investing in resilient healthcare systems and emergency response. So climate change is already straining our healthcare systems on a daily basis, but imagine that impact during emergencies as well. So I just want to also highlight that fossil fuel dependence, the burning of coal, oil, gas, this dependence is the main driver of climate change. And not only is it worsening climate change, but it worsens air pollution. And air pollution leads to, of course, decreased air quality, leading to respiratory illnesses, cardiovascular illnesses. We see increases in vector-borne diseases, increases in mental health conditions when people are displaced. And so it's important to also acknowledge how climate change is impacting our healthcare systems on a daily basis. We also see a strain in our...
to recognize, just to interject, not only in terms of respiratory illness, but in terms of cardiovascular events, stroke, heart attacks, air quality is directly linked, which is something we haven't really been pushing. I often say that as in our move towards an NCD agenda or solution, there's this vehicle that's moving, that certainly has a lot of political will, and that is climate. NCD needs to be in that vehicle as we move forward. So my question is really, how can we leverage the political priority of climate change to elevate and advance the NCD action agenda?
So good point. Coming out of COP, so COP29 was dubbed the finance COP. And during COP, the health community was asking for trillions in funding. This is based on analyses, and also asking for grant-based funding. So I think an important point to bring to the conversation is, how are these finance conversations including health? Are we accounting for health when we speak of the estimates for loss and damage due to the impacts of climate change? Are we accounting the cost for the impacts of health when we talk about the cost for adaptation? So in these climate conversations, we want to also make sure that we're advocating for health. And then secondly, I want to highlight national climate plans. So last month, countries' national climate plans were due. They were due on February 10th. However, we only saw 14 out of 198 countries submit their climate action plans on time. So that's concerning, but it's also an opportunity for us, the health community, to make sure that these national climate plans that each of our governments have agreed to submit under the Paris Agreement, that also accounts for health and NCD care. So whenever we are seeing, as you see, as we've mentioned before, sustainability and climate change is getting a lot of attention and focus by our governments. So it's important for us to advocate for health in these conversations, advocate for health when it comes to finances, and then also it's important for us to make sure that we are advocating for a national climate plans to include health.
Very well said. And what I'm going to say here, as the climate gets hotter, I'm going to put all of the panelists now in the hot seat for the next 7 minutes or so. Because there's some very interesting questions coming in from the audience. And this one I have to ask because I know there are medical students downstairs watching. How can youth be engaged in the high-level conversations? How can young people, I almost said like us, but like you, Michelle, how can young people get involved in this whole UN high-level meeting? Or to any one of the panelists?
So I'm happy to jump in here as a proud member of Healthy Caribbean Youth. I think that as youth, we have innovative ideas. This is the age of social media. If you have been keeping up with some of the developments in social media, you might have seen how youth would have challenged the upcoming TikTok ban by doing a blackout on all other social media platforms. I think that's just one innovative example where we saw youth come together from their houses, not even actually coming together physically, and just deciding to do something to make a statement. And so I think we can come up with creative ways using social media, but also even traditional ways of writing to our governments, both ends, to make sure that they're aware of what we're calling for.
Sure, I like that comment, actually. And the next question that has piqued my interest here, how should the need for climate resistant agriculture be reflected in the teaching of agricultural science? I guess, how should we incorporate climate resilient pedagogy in general climate resilient health systems, for instance. I know, Gloria, you have some thoughts on that.
Yeah, we've, especially as we know, this SIDS, the small island developing states, due to its vulnerabilities, its location, the disasters, the hurricanes, within healthcare, we have been promoting smart hospitals, smart healthcare facilities as a strategy. That is a response. They actually, during Beryl hurricane, some of these facilities is really sustained and showed, yes, they can continue to be standing. That's one aspect of being that physical infrastructure aspect. But we really want to be thinking about it in almost every aspect, in practices from hospital mid-level to down to the health center level. And this is where the conversations around folks from climate, and now within PAHO, for example, there is a whole brand new department where social and climate determinants of health reside. I invite you to visit, for example, that the information, because we more and more we're trying to build that bridge between health and climate change as for the very many reasons you mentioned.
Sure, thank you. There's so many questions coming in, many of which we've answered here, but some we've also answered on the webinar. And I know that we are just about at the limit for time. So no pressure on the panelists, but I'm going to give you 30 seconds to do your wrap-up point. Just one key point you want to leave with the audience for accountable action. Let's start with you, Debbie.
Just to say that conflict of interest is not only private sector, it's also in government, so we have to look out for it. For example, we were on a committee deciding on FOPL, and several of the organizations all reported to the Ministry of Industry and Commerce. So we need to be mindful of conflict of interest in other settings as well.
Very important point. Michelle?
So I'd like to land on 3 key things. Number one, for the NDCs that, as I said, are due this year, the Global Climate and Health Alliance released a Healthy NDC report. So I will link that in the chat for anybody who is interested in a resource that you can use to approach your governments and your leaders on making sure NCDs and health is included in climate plans. Secondly, the Global Climate and Health Alliance also has a Latin American Caribbean network. So if there are any health NGOs on the call, civil society who is interested in deepening their work in this area and collaborating with others in the Caribbean and Latin America, I will leave the application form in the chat as well. And lastly, I want to highlight that even in emergencies, we should be careful with what we are sharing with our communities, what donations we accept. So I just want to also make a point that I will link the HCC donation protocol in the chat as well. So just sharing some final resources in closing. Thank you.
Thanks very much. Over to you, Gloria.
Thank you. I do want to point out that, yes, we have to also start changing the narrative from this personal and lifestyle responsibility to truly moving toward that. As I mentioned earlier in my presentation, it's about changing the environments. So the food environment, the physical activity environment, the alcohol environment. It's only through that we'll be able to make changes. And therefore, the interventions, not only WHO, PAHO, but that are coming out, our universities here in the Caribbean conducting very important research, that we base our interventions on that proven research, that we look at items as a front of package labeling based on scientific evidence, because there is too much on the line, the health of our children, adolescents, and overall the entire population. Thank you.
Thank you. Stanley, over to you.
Good. And the key point is that, yes, we all agree that fiscal policy taxes can play a key role in behavior change by all segments, consumers, providers, policymakers. But we do need to have much more rigorous and targeted policy research to guide our action, because we really need to pin down the range of factors, the range of social, economic, political factors as well, that will facilitate or frustrate the effectiveness of the policy pertaining to taxes. And Chairman, if I may just conclude on one comment, or because we spoke about climate, to link climate, health, and financing. Recently, Barbados and a couple other countries have gone the route of a debt health swap, because all Caribbean countries tend to be are really largely heavily indebted. Can we begin to make use of a debt health swap, like how in the past we've used debt and climate swap, debt and environment swap in the past, to try to get some additional funding which can be targeted to the health sector? And that's an opportunity which can be there for all countries.
Which I'm sure is happening at a parliament near me now, actually, that very conversation. So panelists, thank you so much. Presenters, thank you. But most importantly, the audience who stayed with us to the end of this webinar, I believe we're bang on time. Thank you all for joining us. I think this this HCC hosted meeting, as we prepare for the UN high-level meeting number 4, has really driven home the point, the importance of accountable action, as I stated, but also has highlighted some significant barriers that may be of peculiar importance to small island developing states, such as vulnerable health systems and commercial determinants of health. We hope that you will follow a lot of the links that have been shared, including the NCD, WHO NCD best buys, and other documents and links shared by our panelists. We hope that you will also reach out to us. Don't forget to like us on all of our social media sites, Instagram, Twitter, Facebook, but also check out our website for more detailed information, everything HCC is doing, and also so you can feed in on your suggestions for the UN high-level meeting. I've been your host, and you have attended this meeting, hopefully with some exercise. Go out there and let's think healthy and making the environment a healthier space. Thank you.